Looks like Slim's got a little paper cut.
It's nothing.
Come on, man. No, I'm gonna make you tell me.
Hey, kidney transplant.
When, dude? I didn't know you were sick.
I was donating it.
You gave your kidney to a complete stranger?
Yeah, saved his life.
And save a life by being a living organ donor on matchingdonors.com.
Okay, everybody, your clocks are pretty close. I'll go with that one. I'm going to call the meeting to order. Thank you all for coming. Thank you on Zoom for coming. Madam Secretary, do we have a quorum? We have a quorum, no. Okay, so let's then do the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Would you like to do the honor again?
Me?
Oh, there.
Part way up.
I know. I'm trying to catch you.
Our Father in heaven, how grateful we are that we live in this land with our many blessings of being here. We are grateful for the opportunities for each of us that we might grow, that we might grow closer to one another. We ask thy blessing to be with us this night, that we might have thy Spirit to guide us, direct us, to help us to do that which is most beneficial for this facility and our patients and our employees. We say these things in the name of Jesus Christ. Amen.
Amen. Amen. Thank you very much. Okay, first thing on the agenda is the employee of the month. And our employee this month is Miss Keisha. Okay. This is my words. Keisha is our employee of the month. She is a strong manager and professional. She was recommended for her position by her staff of radiology because of her leadership skills. She's a good listener and a fair boss and manages a very efficient department. She is very deliberate and thoughtful about radiology needs and additions and patient care, I might add, and customer service. And you are stated as a good team leader, fair, and supportive. We truly appreciate all of your commitment to WCHS and our community. And I don't know, you got some guys here from your department, I think? Does anybody want to add?
Thank you. We love her. We want to keep her.
You're loved.
Thank you.
We're very happy. She's been very
thankful for all of you.
I believe, if I'm not wrong, that you were a traveler, is that right?
I was.
And now you're a permanent person that can never leave here? So, we really appreciate
Well, thank you.
Keisha.
Yes, I'm very thankful
You're
to be here.
amazing.
Oh, thank you.
Thank you so much.
Thank you, everybody.
Okay. Thank you. Thank you guys for coming. Thank you for coming.
Thank you.
I did get some of this info from the people. Okay. Next on the agenda is any visitor comments? Do we have any visitors with comments? Anybody? Anybody online? Okay then, thank you.
Madam Chair, I'd like to make some comments, please.
Sure.
So, for those of you that are unaware, earlier this week I sent out an email asking for some basic information that we have been provided as a board in the past. And I was first questioned by 2 board members on why I needed the information, and then I received an email from our CEO stating, I have decided not to give out any numbers. This is absolutely not okay. A unilateral decision by the CEO or employee to withhold financial information that's historically been given is not okay. It absolutely has no right to question the request of a board member. All the board members were CC'd on this request, and I had every right to do so. Whether the information contains errors or not is irrelevant. Each one of us deserves a chance to review and assess any information for ourselves. In my first year on the board, we were provided with financial packets, all of us, before every meeting so we could prepare for the meeting. It's unacceptable that this is stopped. It's also unacceptable that our CEO, board chair, and treasurer are using the excuse that reports may be incorrect, and the rest of us are being forced to accept their word for it because of what can only be perceived as an attempt to control, and they have shut off access to documents. We, the board, and the public, which is the reason why I'm making this in public comment, deserve the right to judge for ourselves the health of the hospital and the manner in which it is being managed. In case you're wondering why employees are leaving and morale is low, this is exactly why. If you're marginalizing the employees like you're trying to marginalize me, I know exactly how the employees are feeling. And for any employee to feel the least bit of fear of retaliation for talking to any board member is absolutely appalling. It's a culture I definitely would not condone, and I'm not proud to be a part of in any way. So I ask my fellow board members, are you okay with this lack of transparency and accountability? And are you okay with this apparent attempt to take power away from all 7 of us and control it by a couple of us? Any attempt to imply that a request from a board member has to be evaluated or approved by another board member is not okay. And the community is not amused either, as is evidenced by the lack of trust that they have conveyed to me regularly, the confusion and the number of questions staff had for us lately about who they can talk to and about what, and the results of the recent poll in the newspaper. We are clearly not on the right track. Much more transparency and accountability is needed, and I urge this board to start making changes immediately, because it's not okay with me, and I don't think it's okay with our community. So I have to say.
Well, I'll make my first comment that I respectfully disagree with what you say. I didn't say you couldn't have any information, I simply asked you what the purpose was. Just
Yes,
wanted
I
to
did
know
that.
what your purpose was, because the board didn't sanction any kind of a report or inquiry. And like I said, we talked about it at the finance committee, and I said, if you had asked about it and got the board's approval to do this kind of a study because the board wanted it, and that's what we had requested, and you wanted to take that upon yourself, I think that would be perfect. I just wanted to know the purpose. I didn't say you couldn't have anything.
So, for the public's information, the reports that I asked for have been included in our financial packet and provided by this hospital. These are the scans that I sent you are from our past financial packets. All of you have seen them, and
from what we understand, they're aired.
they're not errored. You see this report? You go to the schedule and count 1 patient, 2 patient, 3 patient, 4 patient. That's all I asked for. I did not ask for a detailed financial. I asked for the number of patients we see in the clinic. It is not okay for, it doesn't matter if you think it's relevant or not. It doesn't matter what you think I'm gonna do with it. It doesn't matter. I am a board member. I have every right to ask for it.
So
That is not the point. The point
everybody-
is the lack of transparency and accountability that everyone here is feeling. It's not right.
So every board member would have that same right to come up with work for the employees and the CEO to do.
If they needed it.
Would they ever get anything done, would be my question. I mean, if each one of us told Piper, I want this report, told Randy, I want that report, or anybody else. Board members don't generally act individually, they act as a group.
No, they should not act individually. We act as a group. And the reason I didn't see anything wrong with it at the time is because our CEO, who is in charge here, said that he doesn't want any numbers to go out until our assessment is done, which is close to being finished. So I was respecting his request.
So I agree with Carrie. At the finance committee meeting, you guys basically decided, so without the rest of the board, that a single board member cannot receive information that all the rest of us, that we all have a right to. And you've been complaining over and over about, we have to do it as a group. We can't just, and yet she had everybody CC'd on that. Everybody knew what she was asking, and 2 people stopped it out of the 7.
The only
That's
person
not
that stopped
okay.
at him was the CEO.
He's our employee.
Well, let me make it clear on the emails that I received, and I can give a copy of the emails to the public stating that it was a request that I would go and get Miss Maureen's computer and get the information. Maureen does not work here anymore. I don't know where Maureen's computer is. And to get them numbers rather quickly, I'm not privy to that information, but I don't have Maureen's information. I don't have her computer. So I did not know where to go with that Ms. Drost was asking. And I was always told that if it didn't come from a board as a whole, we were not to give out information, or I would be more than glad to answer Mrs. Drost's answer.
The first email, I didn't mention anything about Maureen's computer. And I do think that you could have asked Piper, because I would guess, I don't know, but I bet that Piper knows how to get all of those things that Carrie asked for.
I guess I'd still like to know what was the purpose. That's the only question I asked, is what was the purpose of the data that you needed? I think that's a reasonable question. What are we gathering the data for and spending the time gathering it? What do you hope to find?
Why was it a part of our old financial packet?
I don't remember ever seeing each individual doctor's patients on there. I do not remember that.
I'll just say I didn't interpret it that way, Carrie, in a sense of like those two necessarily like saying you can't have it. The way I was reading it, and we're all interpreted differently, the way I was reading it was they asked exactly what they said there. And at no point did those two ever say you can't see it. At least the way I interpreted it. That's as I was reading that, but then it, and that's kind of the, coming from Randy said, I'm not going to release that information. And that's really kind of how it all played out. At least that's how I interpreted it.
Yeah.
So I did it myself. I was like, I wonder what she wants that information for. Not that I wrote anything out about it, but I was just curious to know. I don't think that's crazy to wonder that, but I just didn't reply to it. But that's where I was asking. I wonder what that's for. But outside of that, I was like, yeah, go ahead.
Oh, I was just going to say, at the finance committee meeting, it did feel like it was just decided that we aren't going to give that information to Carrie, period. And Carrie's name was not mentioned, but it was, we're not going to give that information.
Was it discussed at finance?
Mm-hmm.
Yeah, Randy did bring it up at finance.
Yeah, I brought it up because we decided not to give out any financial information until the assessment was complete, because false information to the public creates false information.
Carrie's not the public.
Carrie's not the public, but under my impression, since I have been here a few weeks, I was told that any information that the board requested, it had to come from the board as a whole, not one individual board member. Now, I do have the email that states, yes, what Carrie is wanting, and I would have been more than happy to present that information to it. If the board would agree, yes, please forward that information to Ms. Drost. I would have gathered it, and it may have taken me 40 hours. I don't know.
You went back to 2021.
I did not understand the last email stating, please go get Miss Maureen's computer and get the information and email it to my personal email in Excel format. I can forward that email to everybody and a copy to the public. I have nothing to hide. That is the way I interpreted that.
I don't remember getting a specific report like you were mentioning. I remember utilization reports
Yeah,
of
me too.
departments, numbers. I'm
never
just
got
saying,
that.
I don't remember
I
their
don't,
number.
me either.
You guys all do. You all
From
know
my
like,
May
what-
financial packet.
They were those thick
That's all I'm
packets
saying.
that
I
you
don't
thumb
remember
through
Let me see
every,
those again, because
and it had every department's information in it.
this is by provider.
Correct, which I pulled out of our financial packets. And I went all the way back to October of 22, and they were in every
Actually, it's
single one of our
21.
packets.
November 21.
So Maureen was here.
But I guess you're not really, if you're debating these little things, you're not really catching my point.
No,
So.
we would just
can
like
we
to know,
Go ahead and move on.
what is the purpose?
I do believe there's a comment.
I'm not trying to put anyone on the spot, but I'm also part of the board. And every board member has a right to look into making decisions on the board. In order to do that, there's information required. I'm not trying to unbalance the scale. In my opinion, might mean nothing, but I've heard of no board that you need the board's approval. If that was the case, then if the majority, if you were doing it by majority vote, if there's whatever your majority is, says she can have it, or if you don't have a majority and they say you don't, how does a board member make a decision? And I don't even know what the material's for.
Well, we
How do
don't
they
either.
make, well, but it's not, for example, if I want to look at something on the county budget, even as a chair, it doesn't matter. I can go to the clerk and request any information that I want. It's public information, and I can request anything that I want to request because I want to, maybe I'm checking on how much office supplies cost, or maybe I'm checking on, how much was gravel for these roads, and I want to compare to see if we can cut the budget. I've not heard of any board in that capacity unless you have some bylaws that can say Jim Smith can not have it because we don't understand what it's for. That shouldn't be the way. I mean, it's public information. It should be easily gotten, and I have no idea what it's for. And I'm just making a comment. I think you can. I have a lot of respect for Randy, but I'm a little confused on you need the board's approval to ask for information because that's not even how it works at the county level.
Well, it's not even that clear, because it's a matter of all the board responsibilities. Everything I ever read says the board works as one.
They do.
We can't have individual board members reaching out to employees, haphazardly when they have a job to do too. If they come to the board and they say, hey, I think we need this information, and everybody says, you don't need to have you need to have kind of like a buy-in. Approval's kind of harsh, but you kind of have to have their buy-in to say, yeah, the board would really like to see that, and Carrie, if you want to do this, be my guest, kind of
Or
thing.
maybe, could I speak?
Yeah.
Carrie, if you just say, I want these sent for this reason, and when I read it, I didn't answer because I'm like, what is this?
Because we never seen it.
We just need to know
like
what
if
you
said,
were
would you send
doing.
it to all the board members, or, I just didn't get what it was for.
Yeah, like I said, I wasn't opposed to it, like the information, I
Right.
definitely
Me
wasn't opposed
either.
to it, I was just out of curiosity wanting to know, I wasn't opposed to it
And
at
if
all.
I had the information, then I could certainly show you exactly what I wanted it for.
Okay, I just, like I said, it
And
was
I would have
never,
been happy to have a discussion
But my first
with you,
question-
I think.
right,
as I
Okay.
have in the past.
Right.
Told you exactly what I'm
Right.
thinking and what I see in the numbers, but I don't have any numbers.
Right. I just don't want to sound like everybody it was this giant conspiracy to hide information. I don't want it to come across like that, because the way I perceived it, my natural question was, I wonder why she wants that information. Not just out of curiosity, what did you want to do with it? You know, and just how would that help us? And that's how I interpreted it. I don't know if everybody else did. So, but I didn't think that it would stop. I think there was questions, yeah, but eventually it got stopped. But I mean, there's definitely questions wondering, like, just kind of what my natural question was too. What is it for? But not in a nefarious way. I don't want it to come across that way. Just out of curiosity.
And I would have been happy to explain it to you,
Okay.
but we don't have any numbers.
Okay.
Well, you have back to 21. What were you looking for? I guess that's my question. I can't.
I was looking, we had an open house for a physician who is looking to come to this community. And he wants to work a couple of days a week. So I wanted to know what our current provider workload is in the clinic to evaluate if we have enough visits to warrant another physician. So I was preparing, I always try to prepare in advance for questions that may come up. So
Wouldn't that be something you'd send to the CEO?
Leanne,
She did.
I did.
No, I meant the physician thinking about coming here. Or are you just a fictitious thing? I mean, is that what you're saying?
No,
You
we had
actually
an
know-
open house
No,
for a
Haverly, she's
physician
in
here.
there. Oh, that guy, okay.
Okay.
We had an open house a few weeks ago.
Mhm.
So I, as a board member, was doing my homework to see if we had enough visits and if the provider if there was a potential to bring in enough revenue to cover said provider's salary. I was doing my homework as a board member, but I don't need to explain what I'm doing. I will do my homework and then I will come to you with a conclusion of what I think when you ask my opinion. But I cannot do that if I do not have data. And I don't have to explain to you what I am doing when I ask for something. When I get the data, I'll be happy to explain it to you.
When did you start working on this?
When was the open house?
When was she
Weeks
working?
ago.
2 weeks ago?
When was she working on this with you? Several months ago?
No,
The stuff,
I was
the
not.
stuff that she asked, that Judd sent me that spreadsheet and asked for the revenue, was looking at revenue. Was looking at what our reimbursement was from our payers.
Right,
That wasn't looking at clinic visits.
Okay.
That was
What
in
I
a,
asked
that
for
was
was
in a
clinic
pile on my
utilization
desk.
numbers.
What?
And that's in the
Miss-
board share drive.
Mhm.
Yeah, what Carrie had sent me, what she wanted was on my desk from when Judd was here.
So, well, thank you for sharing, because that would have been real simple.
Yeah,
You just
so
said
just kind of.
what you were doing. I would have said, great.
Yeah, go for it.
And I know
But
my-
he doesn't want to send any numbers out, and I was just respecting him. I didn't tell you you couldn't do it, I just asked you why.
I am a
She couldn't
professional.
do it
I
without.
understand that.
I
As am I.
operate at a different
Pardon?
level.
What'd you say?
I said she
So
couldn't
I
have
have a
done
right
it
to
without
ask for
revenue.
whatever I want to. I don't have to, when there was an issue with med cards and med errors or whatever, you're a nurse. You wanted to understand the med pass, so you walked yourself down to the hospital and you did a med pass and you looked at the med cart and all. That's your expertise. No one questioned why you were looking at a med cart or wanted to do a med pass. Nobody asked you why, and nobody told you you couldn't go and talk to a nurse.
That's
We
a totally
all
true
had,
story.
no, it's not.
To Carrie's point, I think
Yeah.
it is time that we figure out some of the statistics and some of the things that we have had in the past, and I know that we have, you know, this and so forth, so I will express.
I think we're all frustrated that we don't have the correct
Yeah, I think
data.
it's time that we made sure those things happen.
And
I agree,
can we
'cause I
start very
miss it
small?
too.
My request is very small, very small.
Like I said, if it doesn't, I was under the impression, if it doesn't come from the board as a whole, nothing goes out. Or I would
And
have
that's the
provided that information. And I can get that information, I'll get the original emails that was sent out if anybody wants to look at them. And the news wants to look at them, I have no problem with that.
Anybody else?
So essentially, there needs to be this level of trust when a board member asks for something and that's what you're asking for.
Right.
This level of trust.
And I
To
agree.
get that information. But from my perspective, because I hope that you trust me, and that my curiosity for what you were using it for could be helpful to me to understand. And I know you say you wanted it, but that communication about I'm doing this. I mean, you talk about transparency. Maybe or I don't know if I felt this way, but like, what is your purpose with that information, you know? And maybe there isn't trust. Maybe that's what we all got to figure out is, do we trust each other with information? Why are we doing what we're doing? What are our decision making? Is there trust? And we got to get to the bottom of that and iron this out so there isn't this distrust, because it sounds like that's what we're dealing with, correct? I mean, would you feel that way? I mean, I'm not going to put you on the spot like that, but that's the vibe I'm getting. And so we can't move forward until we do take care of this. So.
You are 100%.
I think you are exactly right, Nick. From my perspective, is that there's not very much trust on either side.
Well, we've got to figure this out. I mean, eventually, we can talk about that, but I think that's got to be, until we get moving forward. We can disagree for days. I mean, I want us to understand, we're going to disagree. Every board disagrees in this county. How do we move forward so it's not this faction versus this faction? We've got to find a way to do that. And I know that sounds like it's all old hands kind of kumbaya stuff, but the reality is we have to. I mean, that is. People are looking at us right now. All over and waiting for us almost to make a mistake. I feel like that. Like there's an expectation that we're going to make a mistake and our policies are going to be bad. So we've got to find a way to get together, and there can't be this disconnect. So that's what we got to work through.
Right.
So the community can trust us, so our employees can trust us, so we can trust one another. I'm just, we're all adults, and we got to work through this. Maybe I'm talking out of frustration right now.
No, I totally agree, and I think it all comes down to education. You guys are grown adults. I'm a grown adult. We're professionals. And I think it boils down to education, and I think you definitely need a board retreat.
Yeah.
I think it also is education and respect. We need to treat one another with respect. When a board member asks for some information and it's immediate distrust, that is not respect.
I don't think it was distrust.
Not at all.
Most certainly.
That was
You
the
just
distrust on my
asked-
point.
You just asked what I would use it for.
I'm just asking.
If
I
you
would like
trusted
to
me, you would just give
suggest
me
that
the
we move
information.
on with the agenda.
Agreed.
I believe that this is something,
I delivered it, sorry.
Agreed.
can we move on?
Are there any other comments? Public comments? Anybody? Okay. Are there any additions or changes to the agenda? Hearing none, may I have a motion to approve the minutes and from the last meetings and also from the last board meeting?
I have a comment on minutes.
Sure.
There's something that needs to be changed. Minutes from, the manner will be working on their quality rating, and I wrote it in here, if we could just make this little change about the manner so people understand what they're talking about.
Sure.
Okay.
Do you want to read it so everybody else knows?
Manor will be working on their quality rating to get it back to a 5-star. This will require trying not to send Manor residents to the ER because it lowers the score. Working with providers on ordering more outpatient testing before sending. And it was just a little confusing, and then Kim cleared it up. Thank you.
Okay.
Yeah, Kim, you'll probably talk to that later, right? Yeah.
Yep.
So, okay, thank you. May I have a motion to approve?
I so move.
I will second it.
Thank you. Discussion? Opposed? All in favor?
Aye.
Opposed? I'm sorry, I said that first. Okay, thank you. Motion's passed. Finances, Randy?
Yes, as mentioned before, we will not give out any finances at this point until the assessment is done by Durbin. I did talk to them yesterday. They did have a death in the organization. However, the assessment will be complete next Thursday. As soon as that is complete, I will email every board member with that. But I think Piper has some statistics to give out, and Jennifer has some information to give out as well.
There's 2 sheets of statistics. We don't already have them, and then the overtime report. I'm sorry, so shut it. Thank you. Thank you.
Oh, wait, I have 2 of this.
Do you mind if I go first so I can get my daughter before?
I don't really know.
So, my name's Jennifer Stolkin, and I am the APPR specialist for the hospital district. And in July, I do have the badge of accountant, so I do go over the bank accounts every morning. And I do have the cash flow report for January 2024. So for our income, for our operating receipts, we received $2,706,842.17. For retail pharmacy, $506,277. Merchant account, $148,071.15. Money market interest was $12,554.35. Avidify was $14,672.09. Harry Ackley Memorial interest was $2.38. Operating disbursements was $494.98. So our total monthly income was $3,388,837.89. Our operating expenses for our accounts payable and our payroll was $2,051,457.76. Our hospital district pharmacy, which is the cardinal that comes out of the operating receipts account, was $93,348.37. Our retail pharmacy was $329,938.98. Our merchant fees were $6,364.60. Our care credit fee was $5. Our Vidify fees were $5,458.02. Our monthly expenses was $2,486,572.73. And our January outstanding AP checks were $320,558.17. And the reason why I cut so many checks at the end of the month is because we started a new accounting system on February 1st. Our total income after the expenses was $581,706.99. So for our money market, I already told you that our interest was $12,554.35, but I also made some deposits. So this is something really positive that I'm happy to share with you guys. I made on the 24th of January a $300,000 deposit in there because we had extra cash in our account. On January 21st, I made another $300,000 deposit into our money market because we had extra cash. On January 9th, there's $322,713 that went in there, and that was for our oxygen grant. And another $100,000 was deposited on January 9th as well. So for our, we do get 5.09% interest in there. Our ending balance was $3,520,146.88 in the money market. And we also have a CD, which is at 4%, and that is $2,081,433.82. So with our CD and our money market, we have $5,601,580.70. So I just thought I would share that with you guys.
Thank you.
You're welcome.
Thanks, Jennifer.
Did you send that out on paper? Because I couldn't write as fast as you talked. I gave up.
Yeah.
Thank you. You're welcome.
My notes are. I was just gonna say.
Email to all of us.
Well, I think that, you downloaded that information, right?
No, but I can get it from her, and I'm planning on putting that in the minutes.
That's the one she presented at the executive finance.
Yeah, because we sent it to you, Ann, right?
Yep, I got it.
She's got them online, so.
will. I got him on the email.
Correct.
Yeah.
Okay. Okay. Let's see, who's next? Leanne. Did you want to go ahead? Or-
I handed out the statistics.
Yeah.
I did update the prior year to date
Yeah.
and the actual year to date, because that last column was miscalculating. So I did update that from the finance committee.
That
So,
looks better.
Yeah. So utilization for January was up compared to December in all areas. There wasn't really anything super outstanding. If you look at the manor days, we talked about this a little bit, that they're gonna try to get up back to that 43, 45 range. They're doing, once the COVID outbreak is over, they're gonna start doing admissions.
Is there a
again.
second page on the
Yeah,
back?
there
or-
should be 2 pages.
Oh, okay. That's okay. I'll
So-
get it later from you. Copy?
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
That's okay. I'll get it later from you. Copy?
So we reviewed
Thank you.
those, and then, we also then looked at the overtime report at the finance committee, and overtime was down by about 100 hours last month, so.
Okay, yep. Epic, does anybody want to do Epic, or do you want me to do it? Okay, Epic AR days were 64.2 days. It was a decrease of 3.6 days, AR days. The ER insurance, I'm not sure about that one. Okay, hospital billing AR days was 62. Hospital billing for self-pay is 22.5 days. And professional billing self-pay days was 57.8 days. The other and then we did the other projects. We talked about the other project, the HVAC and stuff like that. So I'll let you talk about that.
You did?
Yep.
Okay. Okay, Kim, you're up. Credentialing, this month we had Dr. Franklin for reappointment, Dr. Terry Bivey for reappointment. Gordon Stewart, he's the new PA that's working in our PR, getting him credentialed. And then another Blue Sky neurologist, Andrew Ferguson. Everything in their charts was good. Andrew Ferguson's a very new provider right out of school, so.
And what department?
Neurology, he's part of the telehealth. Thank you. Yep. Any questions on them at all?
Just that one expiration date.
Yeah, I'll look at that. and
Okay.
fix that.
You can keep going.
You have to make a motion to approve them.
Oh, I'm sorry, forgot. I always want to sign them, send them away. May I have a motion to approve the credentialing claim? Okay, may I have a second?
I'll second.
Any discussion? All in favor?
Aye.
Aye.
Opposed? So moved, thank you.
Going to med staff. We had Dr. White in-house. He came down to talk about pediatric radiation exposure. He actually gave some really good information on pediatric exposure to CTs and x-rays, and gave some examples of how many normal days in the sun a CT is and an x-ray is. Very, very knowledgeable.
I would say he was excellent.
He was very good, yes.
So just reminding the providers to just be mindful if they're ordering CTs on pediatric patients. He said that, one CT, there's not any perceptible risk on doing a CT on a child. It's when you have multiple CTs on a child that's when it starts to add up that radiation exposure. So he said use it if needed, but just consider the exposure. And then we just kind of talked about real radiology. They read our exams at night. If somebody comes into the ER overnight, the real radiologists, they read those exams, and then Dakota Radiology, their providers come in and reread those exams, and they either update that exam in the chart and let the providers know that way. Pharmacy, Joy said that there's some back orders on Norco, oxycodone, some Miralax, Ozempic, oral lidocaine, racemic epi, and some ADHD medicines, but right now we're all good. She's keeping up with them. There were some DEA issues with some of the narcotics, so so far we're not having any issues, but we could maybe down the line. Just kind of have to see how it plays out. She did some education on some Vancotrap lab ordering. So she said if you do an initial low dose of Vanco, you need to do a trough. It needs to be drawn before the third dose. But if you give the same dose continuously, just making sure to draw that trough at the fourth dose, just to make sure that they're therapeutic, not getting too much. And then she discussed phenobarbital. Some of the providers were asking to keep it on hand. She said it was pretty inexpensive, and so she was going to get some in and just track the usage and make sure that it's something that we need. Radiology, Keisha gave her update. Jamie and Jamie, they completed their carotid training, and the trainer was happy with their exams. They're not quite ready to do patient scans right now. They just were having to practice some more and send their scans in. But they should be probably ready to rock and roll here shortly, I would think. Yep. DVTs, they're still doing DVTs. They're still back scanning each other just to make sure that it's an accurate, good test. We talked about the one MRI vendor. The day we had med stuff, we had 10 scheduled for that day, so that's a pretty good increase in numbers. And then we talked about the low dose CT scans for patients that lung cancer screening. If they can pay cash for it. If Medicare, I don't think Medicare pays for it, but that's
it does.
Oh, it does.
Mm-hmm.
The cash price is about $400.
Yeah,
is what I had written down.
Yeah.
So fairly cheap if somebody wanted to have it done. Lab, Jim talked about a respiratory panel machine that they would like to get over at the clinic for urgent care testing. He said it's around $50,000. He said there's a $12,000 implementation fee, $4,000 for 30 tests. So just trying to see if the benefit and the cost would be there to do that. Let's see here. Nursing home report, at the time there was 38, census of 38. We had 5 temp staff. We did lose 6 residents in December, but did have 3 new admits also in December. So we're just trying to get the numbers back up. We admit a couple and then unfortunately we lose a couple, so it's hard to, we're just kind of gaining and losing at the same time. Right now we're on a hold due to COVID. Today that was good. There was no new positives, so hopefully we're working on getting out of that window and we can start admitting some. We've got a couple over in the hospital intermediate swing bed that need to come over. There's a couple out in the community that need to come in, and Melissa was going to go look at one, I think in Upton, go assess her and get her in too. So we've got some on the wait list. It's just a matter of getting open to bring them in. We're looking to get up to 45 with our staffing, so hopefully we can get there.
You're at what now, Kim? 38.
It was 38, but I think we're at 37 currently right now.
We're at 37.
Okay.
Yep. Home health, Heather talked about adding extended care therapy visits for home health. Some patients they were seeing don't have a qualifying diagnosis for physical therapy, and so adding that extended care therapy visit for $75 a visit, so that some of these people that insurance won't pay, Medicare won't pay. Get the therapist in for a few visits, show them how to do the exercises, and get them to do like a home regimen, something, you know, cost worthy for them. Let's see here. We talked about resident rotations, just making sure that we're aware if any residents reach out, doctors, nurse practitioners, PAs, just making sure, you know, because we have to give them a little bit of time, get them credentialed and Epic access. And then manor transfers. I'll kind of touch it in quality too. But our long-term care 5-star quality rating went from 4 down to 1, and we saw that it was because of the residents. When they go to the ER and they don't get admitted and they come back, it deems our quality score. So working with the providers that if something's going on with a resident, to call and get some outpatient orders, you know, get some basic labs, maybe do some outpatient radiology, you know, get an x-ray, CT, something like that, before they send them over to the ER, to just kind of help reduce that ER traffic. That's all I got from med staff. So we'll go quality. We met yesterday. We went over our incidents in January. We had 27 of them. So still down from previous. Patient satisfaction surveys. VTrail sent out 1,196 of them. It had a 15.8 return rate, which was a 3% increase from last month. So that was good, we're getting there. I was informed that VTrail now offers HCAP surveys. So they're gonna get me some information, the cost, what it takes to get them, and it's a CMS requirement for the HCAP, so they'll have to do the reporting and submitting to CMS for us. So she's going to get all that information. Right now, HCAPs is still being done by Survey Solutions, so it'd be nice to get it all on one platform. So, let's see here. Current number of temp staff, we've got 5 CNAs and then 1 RN coming in March for acute care. We went over our credentialing. The 5-star quality report, we touched on the manner patients to the ER. Another thing that we're working on is resident anticoagulation monitoring. Some patients, if they're on Coumadin, they require their INR to be checked pretty frequently. So just making sure that we're monitoring patients on the manner side that might have the order for Coumadin. Right now we don't have any, but just making sure that they're getting that routine INR done, make sure they're not too thick, not too thin, so we don't have any accidents that way. And then opioid stewardship. Melissa and I already do a medication audit quarterly, but we'll just add a little bit more robustness to it. Looking at PRN usage. If they're not using the PRN meds, maybe we need to just discontinue them. If they're using the PRNs quite a bit, maybe we need to schedule them regularly. Maybe we need to increase the dose, decrease the dose, just looking at things like that. That'll help that score as well. Home health. Heather was looking at her medication reconciliation. They're going to try to do it every time that they go in and fill the med boxes, the pill boxes, making sure that all the medicines are still the same. And then the CNA oversight, which also came off the survey. She said it was going well. Therapy is also signing off on the CNA oversight when they go in, so that's well. And then she said they had 5 to 6 admissions last week. The clinic, the survey return rate in January was 15.46%, which was a 2% increase from last month, so that was good as well. Pharmacy, Joy's still working on the formulary. The 340B, we have a new pharmacist, Suzanne, so she's training her. And then once Suzanne gets trained, they'll be looking at other performance measures that they want to track there in pharmacy. HR, they were looking at some employee file audits, just making sure that everybody's education was in correctly, that their title's correct, you know, anything that might affect their wages is in there appropriately, correctly, so that we can get our employees paid to the fullest. And then we touched on the AR, Leanne did, and that's about all I got for them.
Any questions for Kim?
Thanks, Kim.
Okay, Jamie, the report?
No, just one thing that just quickly needs to be mentioned is that there's a lot of people in the community that if they have sick family members, were very confused on who they could call for help. And there was a lot of, well, we had our town hall Monday. There
What
was
did
a
you mean
couple
they-
who they didn't know who to go to for help here. And they were supposedly told no when they did call here. And when I checked up on that, she wasn't really sure, this person I talked to wasn't really sure if that was true, so. That, we talked about that needs to just maybe get out in the paper, like, hey, if you have concerns, call Kim, call Denalda.
Piper.
Yeah,
Piper,
yes. So that's it.
Just to give a tiny history on that, Jamie, it wasn't just somebody at home looking for something. It was somebody that had a dying family member that was to be transferred. So once there was no bed for whatever reason, they didn't know where to go. Like they didn't know what to do. And I said, we don't know for sure if, how the whole thing went because
But
we don't
that
have any
was cleared
details.
up, because I called up.
Yeah,
and
good.
They did get
Yeah,
out.
so we want everybody
Yeah.
to know that no one is gonna tell you no and hang up in
Right.
this facility. By any means.
So that was cleared up.
Yeah, good.
I just wanted to be sure.
Thank you, Jane. Okay, moving on to old business, radiology update.
Yeah, so I had Phillips come out and look at our room and kind of assess everything that we need to do. Things are looking pretty well. We're hopefully going to be able to use the unistruts, so that's essentially like what the whole tube is connected to in the ceiling, the support system. We might have to extend them a little bit. We do need to double check on the electrical to make sure that it's a 3-phase 480 hookup to be able to support the 80 kilowatt generator. So we just need to double check on that. I would like to do new flooring as well as paint the room because, I want to make it a nice, good, clean room considering what we're about to do with that new equipment. They did come down on price again for us. So originally we weren't going to do a tilting wall stand. The benefit with having a tilting wall stand is it allows us to have, say you have a very kyphotic patient, it gives us as techs more, adaptability to be able to get the images that we need to. Also, heaven forbid, if our sky plate is what it's called, which is the free detector we have, goes out, we can turn the wall stand 90 degrees and we can do like hands, extremities, and everything like that. So we do actually have the space to do the tilting wall stand. I originally had cut that out because we didn't have the space as well as cost. They added that as well as 16 hours of on-site training on top of the 28 we already have and deducted our cost by $14,000. So they came down even more than the original. So that's amazing. I'm really thankful for that. What happens next is once they receive the PO, we're looking at 12 to 14 weeks delivery time. This does include the decommission of our current room. They are giving us a trade-in value on the current room as well as the portable downstairs. So it's a 2-day de-install. Then we can start our construction. 12 to 14 weeks after that, then the new equipment should arrive. We'll have to set up a staging area out back, and then they'll start. It's a 2-week install process. Once that happens, we're looking at a half a day for them to upload all of our protocols, and then we're looking at 3 days of on-site training for us as techs. So,
How much downtime are they doing?
well, at least 14 weeks. So, my thought process, and Piper and I have talked, is that outpatients, for the most part, will go to the clinic to get exams done there. So I'll communicate with Ashley Tupper's office because we do a lot of her patients as well. As techs, we'll get training over at the clinic. So when Jamie's over here doing ultrasounds, and this is going to be a downtime procedure thing only, we'll go over there, fill in, make sure that x-rays are getting taken care of over there. We do have our portable x-ray machine. However, we are limited with that in the sense of it has a 250-pound weight limit, the detector does. There are certain exams that you can't do, a KUB with the patient laying on top of it. We also can't risk our detector for a portable being broken by doing certain exams. So it's gonna definitely be a team effort, but we have a plan in place. Hot Springs did it. I have no doubts that we can do it, you know. So that's where we're at with it. And Randy went and talked to the bank. They did come down. Well, it used to be on the financial side.
I mean, you gotta give credit where credit is due. Keisha has done an outstanding job. This piece of equipment, Cadillac equipment, started out at $680,000 with the GPO already purchasing and some other added, savings, and then negotiations. I mean, Keisha was on the phone, I was on the phone, Piper was on the phone. We got him down to $272,000, which is very, very good. On the wiring part, it will take a step-up transformer, which is very minimal, about $3,600. Then we've got to level the flooring up and then put in new lighting, paint the room, so we're talking less than $10,000. And, we're looking at about 16 weeks. I did talk to both banks, First Northern and Pinnacle, about the same in interest. One is 6% plus 1% charge for the $272,000 for 5 years. The other one is 7.5%. So Keisha and I thought, well, let's talk to Phillips. So Phillips started out at 8.5%, and now they come back with, okay, if your bond rating is this, we get you down to 6.5. I said, okay, I'll see what our bond rating is, and I'll get that information back with you, and whoever has the best deal, we'll go with you. But whoever we go with, I think we need to move forward on this, and you guys need to vote on this tonight, so the price doesn't escalate. But, I mean, between 7%, 6.5 and 7%, you're only looking at $5,395 a month.
Do you remember what our capital budget was for? 200,000. So we're close on our capital.
Yeah.
Why would we finance it? Why would we finance it?
Excuse me?
Why would they finance it?
Well, I think as we move forward with other things that I have in mind, I think, instead of taking money out of reserve with as low as the interest rate is, we should go ahead and finance it. I mean, I think it's for the return on our investment, and as quick as the turnover is in healthcare equipment. I mean, as soon as we put it into place, it's going to be outdated in 3 years anyway. And I would rather have the money in reserves in case a catastrophe happened. We have enough money in there to pay what we need to pay. And the interest rate is very reasonable.
Okay, what was the monthly rate then? Did you say?
The monthly rate?
Monthly rate.
So it's $5,395 a month and 83 cents. And on top of that, which we already are paying for the service maintenance agreement, we're paying right now $2,783.83. Under the new service agreement, for 10 years with 60 days out, is $2,531.25. So, I mean, we're getting a great deal.
And that 10-year service agreement, so say we were to, in 10 years, or 9 years, we say we need a new room.
Right.
We don't want Phillips anymore, or whatever the case may be. With a 60-day written notice, we can get out of that 10-year service agreement with Phillips. I'd ideally like to go ahead and go forward with a 10-year service agreement to protect us. This does include detector drop protection, so heaven forbid that detector is dropped. The sky plate is what it's called. There is a $7,500 deductible. Knock on wood, we take care of our equipment very well back there. We haven't had that issue with any of our detectors, portable or the GE room. But we did add that on just for protection, because that alone is the majority of your prices, those detectors. So
what's the average lifespan?
This machine is 15 to 18 years. Philips is the only brand that right now has FDA approval. So 10 years from now, they can say, and they're actually doing this on 2 of their rooms, they'll say, hey, for $150,000, this is, I mean, now, prices now, we'll come in and do an update of your system. So you don't have to buy an entirely new room. They just are gonna do a big upgrade to give you more life. So a big thing with Philips is, Hot Springs just installed this exact room, the C90, and then Dakota Radiology and the Monument facilities are switching to this. So that was a pretty big pro, knowing that our radiologists are really liking this machine. I also enjoyed that The monitor itself is a 2K, so it's a radiologist reading station quality monitor. At night, past 10:30 p.m., our providers don't have reads on x-rays. My goal with this and my thought is by having that 2K monitor, our providers can have access to it to come look at the x-rays on that monitor as opposed to just the computer monitors. So that's another big pro to this system. And I will probably have to get the physicist in as part of this to just double check and make sure that there's nothing that they have to do their tests as it is radiation equipment. I did tell them I would like this done before Sturgis, and that's definitely, as long as we move forward, that's an achievable goal as of now.
I personally lost the numbers, Sarah, somewhere in there. So what would we be voting on in terms of numbers? Are we looking at a total? Are we looking at the machine's this, the construction's this? Is that how our vote will be structured?
So what I would vote on is the machine. That is your capital purchase. The rest is service, is a service agreement that is already in place. The $10,000 is the construction of the upgrade of the step-up transformer, painting of the room, and new light fixtures. I think we owe it to our community. I think we owe it to our patients for quality care, quality outcomes, all over this organization. And I think it is our responsibility to provide this. The return on investment is going to be very strong.
We have already voted on the Philips system.
That's what I thought.
Yeah.
That's why I
So
wanted to ask the
what
question.
specifically do you want us to vote on? The extra money for the
Renovation for the
paint,
The $10,000, yes. I think that is in a policy, but like I said, I always like to come to the board. If it's $5,000, if it's $10,000. I want you to be aware of what I'm spending.
So we really
Can
don't need to vote.
I ask a question quickly?
Sure.
Before we vote? So I didn't quite catch how much, you were telling us how much the monthly fee charge would be, or the monthly breakdown. I would like to know just how much over the life of the loan are we paying in interest?
It's around $47,000.
I think that for $47,000, we should take the money out of our however many million they just said we had earlier today.
I agree with you, and my financial advisor has been telling me for years that I can make a lot more money by leveraging and taking out loans on things. I like to pay cash for things, and I agree with you, and that the cost, if we're voting on that, I would rather pay cash for it than to finance it.
But
I mean, it'd be one thing if it was $4,000 or $5,000, but $47,000.
yes, but let me give you another caveat. At the end of the year, which you may or you may not be aware of, you can take that interest and you can put it on your cost report. It's like if you're going to build a new building or you're going to renovate.
Yeah.
So if you're taking out a $2 million loan, the interest is hypothetically, say, $500,000 a year. So more or less, you're not going to be paying anything for 10 years because all that interest that you're paying from a healthcare perspective on that loan is going on the cost report, and you get reimbursed for that.
Exactly.
You may not have known that, but that is the truth.
Yeah.
I believe you. I still think that it's. I mean, I absolutely am in agreement that we should get the X-ray machine in the room and stuff. But I personally think it would be better policy to at least while we can. I mean, it's. I would prefer to pay cash for it, or even if you're not.
Right. I will do whatever the board decides.
$47,000 is a lot of money.
I'll do whatever the board decides, but you got to remember, we have a CT upgrade coming up. We have a $500,000 lab analyzer that we are going to be doing as well this year. So we have, a little over $1 million worth of capital equipment that we're going to be investing in this year. So
My concern was that we're just starting to build up and I hate to take it all out.
Me too.
I would prefer to go with a loan and then with the possibility of paying it off sooner than taking everything that we build up and it's gone.
and we have that option.
would we try to pay it off sooner, or would we just try to keep adding more money to our cost report?
No, I think, you know, as we move forward and we're able to put more money in the money market, and from a board perspective, get the board approval, say we have an additional $600,000 a month, you know, in money that we can spend, and then we get the board approval, say, hey, let's go ahead and pay down $50,000 on the radiology equipment, or on the CAT scan, on the lab analyzer, and that's how we move forward with that.
It does give you the freedom to have the cash reserve to use for other things, besides the capital equipment. You know, there may be something else that pops up, and if we deplete this much money at one time, we may not have the money to do that.
I mean, that's just my thoughts, but I'll do whatever the board decides, but,
Well, can I have a motion for the renovation of the room first?
It's within the spending limit, isn't it? The
$10,000?
Aren't you authorized to spend 10,000? You think it'll be over 10?
no.
Okay, so we already have that. You don't need to vote on that.
That's
Take
fine
that
with
for
me, he
operation.
asked for it, so just.
If it comes in more than that, I'll come back to the board.
Exactly, yeah.
And we'll have a project manager on this, so once we
Right.
move forward, we can assign the project manager, and then Ron's involved.
Right.
Obviously, you know, if
And-
we need an electrician or whatever,
Right,
we can set
and
up meetings with the project manager to make sure everything is.
we want to make sure with the project manager here that he does understand change orders, because over the years, you guys were not involved in change orders. So when they did a change order for this renovation for an additional $500,000, you guys did not sign off on it, the money was spent. So, being an engineer in the past, we want change orders. If it's going to increase, I want a change order. Why, how much, bring it back to the board approves, we write a check. They don't approve, they don't get paid.
So,
I think the question here is whether we finance or not.
well, not only that, my other question is, do we have a preference, Phillips, First
I
Northern,
think we
or?
already did that too, didn't we?
I think I think, and, you
We
know,
didn't vote on that. No, Phillips is, we didn't vote on
we
the
didn't, you
loan.
didn't vote
Not
on
the
where you're
financing,
going
that
to
was what
finance.
we-
Phillips.
Yes,
No, we
but
voted
you're
on
talking
it.
about the, like, we finance through Phillips with the
Percentage,
banks.
Right.
correct. So
Yeah.
it's either 6.5 with Phillips, am I right?
Yeah.
Correct.
6 plus 1% with Pinnacle.
7.
I mean, First Northern,
Northern,
and then 6.5. Correct?
No.
With
6.5 was
Pinnacle.
Phillips, 7.5 was Pinnacle,
Right.
and
Okay, start
7
over.
First
You
Northern.
get your
Okay.
machine. I get my machine.
7.5 with Pinnacle, 6 plus 1% with First Northern, and 6.5 with Phillips.
If our bond rating is good,
Yeah.
The
which
bond
it
is-
is.
Yeah. So, can I have a motion with respect to the loan for the new
I'll make-
equipment?
I'll make a motion that we go with Phillips, 6.5.
Okay. And do I have a second?
I'll second.
Okay. Do I have any further discussion? All in favor?
Aye.
Aye.
Opposed?
Aye. Nay.
No.
I think we should split. Split up? Why? I want to meet new people. People who need me. Meet new people? You're my left kidney. You only need one of me, man. And you have two. There are plenty of people out there who are dying because they don't have one. Really? You'll be giving the gift of life. I could be a hero. Yeah. It's all win-win up here, buddy. Why don't you go and save a life, pal? You're doing the right thing.
All in favor?
Aye.
Aye.
Opposed?
Aye. Nay.
No.
So it's 1, 2, 3,
So it's not a
4.
motion
We're
to
good.
go with Phillips for their interest rate?
Correct. Okay, so that's 48, 2 nays, so it's approved. Okay, HVAC system,
Yes, on the two HVAC. So on the long-term care, Mike Essing and BSA Life Structures coming on site the last week in September to do a walkthrough. I will say Mike Essing actually is adding to his documents to include some things that were not in there as well. So they'll be on site to do a walkthrough the last week in February. The 340B, working with Aventi Health on that, but also I'm getting some additional information from Piper on the 340B program. Also on the HVAC, on the heat exchanger, which will come down to item F, the heat exchanger was installed. I am waiting on feedback from our insurance company on the reimbursement for the damage that the heat exchanger, there was a lot of buildup inside the heat exchanger. The clinic update on the rural health clinic across the street, Mike Gassing and BSA Life Structures will be here, like I said, when they do the walkthrough for the HVAC, they're going to do a walkthrough on the clinic and look at space available as well on the inside or where they're at in the clinic on the outside, and what's going to be our best interest on if we can build one on the outside, if we have the space, or two, if we have enough space inside where we can allocate space to build, to renovate a clinic, but do we have to bring everything up to 2024 standards? Because once you start, I don't care if you change that door out or update the fire alarm system, everything has to be brought up to 2024 standards. A lot of people don't realize that until they get in and they get done, and then the state comes back or an FPA comes back, and that's electrical comes back and say, hey, you gotta tear all this out and start all over. You didn't follow the guidelines. So that's what we're gonna figure out. And that note, with adding on to the hospital on a new clinic, if you take a look, we have no space. There we have no ground. Come to find out, the way back hamburger joint is for sale, along with the filling station. Did not know that. I did go and talk to some people. Yes.
Question back on the 340B. You said you were working with Aventi Health. Are you looking to incorporate the community providers as well, like Cambridge
Yes.
Pharmacy?
Yes.
Thank you.
And that's a good question, because Carrie, you talked to the gentleman, Mr. Eric Fromhart. You remember talking to him?
I remember talking to somebody, but I don't know what his
That's
name
who it was, and he had a great conversation with. Yes, once we go provider based, incorporating all of that, the return on our investment is going to be it's going to be about $100,000 there. Right now it's between 6 and 8, but once you add your provider based clinics in there, I mean, it pushes it extremely high. So that's going to be a plus for us. So back to the clinic. Really, the only place we have is, I mean, the land that is available is very cheap. I mean, you've got the way back and you've got the gas station. Probably get it hypothetically for about $1.2 million, but it's probably going to go into repo. But I think it's our opportunity, and not that you have to make a decision today. That's the only land we have to expand. I mean, if we are ever going to expand, and you was in the town hall meetings where we're not only the public was saying, we need additional long-term care beds, we need assisted living, we need hospice care, you know, and we do need it. We do need a new clinic. So I think this is the opportunity to where we invest in land as we move further, as we grow. But that is up to the board. But I think we owe it to the community and to our patients out there, and as we grow, to look at additional land opportunities. And this is the only way we can expand. I don't know, just get your feelings on what you guys think. I mean, like I said, if you move forward with that, I think you need to take a look at what all you're doing. Okay, if you decide to buy that land, you can get it, say you get it for $900,000. That's good. Do you want to take it out of the money market? No, I wouldn't. I would go to the USDA. I would say, let's get that land, let's get the clinic done, let's look at the long-term care, let's look at assisted living and say, okay, everything comes to $3 million. Let's look at what that's going to cost us over 20 years. Hypothetically say you agree on that. Your return on your investment, your payment, just to say that amount per month is really nothing. I mean, your long-term debt is nothing. But that's something you guys need to really think about. Whether it's me sitting here and I fall over dead tomorrow and you hire a new CEO, Denise has everything in a book in there. She knows what I'm doing every minute of every day, just in case I do fall over dead. but it's something you need to think about, the community needs to hear about, and our patients have the right to the care and what they're talking about with long-term care, hospice care, and assisted living. What's everybody's thoughts?
So I have another, I personally, I'm like, that does all sound exciting but I mean, we have to have some financials. You know, we have to know where we're at before we even start thinking about this.
Right, and I agree with you, Ann, wholeheartedly. I was just throwing the land out there because it is for sale. And I'm not saying you go out tomorrow and say, hey, give me $1 million. I'm just saying, as you look to the future, we have no place to expand. Is it a good investment? Probably one of the best investments you're gonna make. But I think you really need to consider that, and I think we owe it to the community and our patients. But I agree.
Appreciate the vision. Like, I appreciate the vision. That's what I really like. But
I agree. I agree with you. We've got to get true financials. We got to have them.
Yeah. Any more discussion?
I guess I'm getting a sense of if we don't act on it, we'll lose an opportunity. Is that what you're
I
saying?
do think it will be sold within the next 60 days. I do. I mean,
I do too. Yeah, somebody else
Dollar
buys
store wanted to
it,
buy the whole.
I would like to buy it myself, but I wouldn't put that, I mean, I would go over and buy it tomorrow, but I would not put it back on, I would not.
Do you know how
go
much
against
they're
the
asking? No, you don't know.
Hmm,
Do you know how much?
I do.
I like the idea.
Yeah, I do too. I think we need to be visionaries and at least, because we're kind of landlocked.
I think the board members need to go look at the facilities. I mean,
How many acres are there, do you know?
I don't know. I mean, I can talk to the bank more. I would like to take a tour inside way back and see what it would take to convert that into a clinic, and all of that. But we have nowhere else to grow.
You asked about
The other thing
yesterday.
that we need to think about in this whole deal is that we can't find staff for our own manor. We don't have it full
Well,
because we have staff. So we make it bigger. What does that do for our staff?
No, it may not make it bigger, and it
Find
might
staff
replace it.
bigger.
well,
What's that?
I said it may not make it bigger, it may replace it because it's old.
Well, I think all that falls back into education, not only within our organization, but education with the school corporation and career fairs, but also career building that we have talked about here in our leadership team on, healthcare careers and having them come in and shadow on a weekly basis to see where they want from a healthcare career in each school corporation, and being a partner with some of the other healthcare organizations around. And it all boils down to education.
While I think it could be potentially a good idea, I just don't feel like I have enough information
Right.
to make an intelligent.
And I don't think I just wanted to make you guys aware of what is out there.
$1 million of their money last year. How can you run out and ask them for more?
Keith, you asked me about it yesterday. Do you have any comments?
I mean,
Or you just asking.
I was just asking. I just think that if it's doable, of course, that's your guys' deal. I mean, if it's doable, I think it's a good opportunity. I know what my goals are with radiology and how I would like to offer more services for my department, but again, I think if the opportunity is there and we're able to do it, I think it's a great idea.
I kind of agree with Randy, though. Educational opportunities are critical because, like you said, we can't staff the manor right now. And I think staffing is a huge concern. And if you do expand, how much more do you expand? You need more workers to fill that. So that's critical. You mentioned kind of reaching out to local school districts. Everyone's got to go to colleges, to be honest with you, because kids leave and then go to colleges and forget about where they were trained. So that's a good starting point. But I think it's almost reaching out to Gillette College or other places and creating a pipeline. Casper College create a pipeline with us. Yeah, places like that. Because like I said, we have people at our high school that come here and then they go to Mitchell or they'll go to other places. And we're pipelining. I mentioned this in quality. We're pipelining to Denver, to Rapid, but we're not pipelining them here. And that goes into your community too. What is your community offering that would bring people here? We could have the nicest facility in the world. Right. What is your community offering 22-year-old kids, in aging communities?
It ain't the nightlife.
Yeah, yeah, exactly. So that goes into it too. So for staffing, I mean, there's a lot of variables there, like how do we get that? But I think a good starting point is colleges. Right. And how do you make your communities attractive to younger people? Because first thing I did was get as far away as possible, and then came back in my wisdom. But I think that's something that we have to consider too. How do you bring and capture talent? Right. So that's a good starting point, though. Is what I'm saying.
Right. I do think we do have to bring careers into the school system. Back in the 80s, I started the Health Career Fest with the school corporation, and it did blossom. It's still in effect today, but I think that's really what we need to look at.
Well, going back to the matter at hand, what do you need from the board right now?
Nothing. I just wanted to make you guys aware of, the buildings are for sale, kind of what it would cost us, and I think it's our obligation to even take a tour of the facilities.
Right, and I think that the sooner we get the assessment, the better we'll be able to know where we are. And because I think that property's gonna go fast. So, but if we can't afford it, we can't afford it, so.
May not be, or not to.
Any other discussion? Okay, Randy, you wanna move on to new business, medical staff update?
Yeah, so Dr. Haverly will be meeting with me next week. I will take him on a tour again of the clinic. He's looking to work 3 days a week. Working on a contract for him because the contracts I have right now are all across the board. I won't speak about them right now. I think that has to do with employee personnel matter. We'll talk about them in the executive session. And then I have another specialist that's interested in coming 4 days a week, every other week. And then I have 4 other specialists, and I won't mention names, that are wanting to come and set up specialty clinics in our clinic that we have here on site.
Going back to the first doctor you mentioned, is ER included in that, or is it strictly the clinic?
No. Family practice for Dr. Haverly, and then the specialist will be the specialty clinic set up.
Said something about a pain management.
Yeah. I think that's going to be a huge success, and then looking at expanding our diabetic program as well.
Medicare seminars?
So we'll work with the senior managers and pick some dates for the Medicare seminars and talk about Medicare Advantage plans and some other plans, and I'll be working with them in the next 2 weeks to set up them programs.
Who are you working with? Who are you working with?
Oh, the administrative team.
Oh, okay, gotcha. Okay.
The community needs assessment. I did finally get feedback from the Wyoming Hospital Association and John Wadsworth. He's with Ready Health. They've been doing it over the entire state of Wyoming, and I thought I'd get them the opportunity to bid on that as well, because we've got to have that done this year.
So do you have, are you just giving one person a chance to bid? Or
No, there's actually 3 proposals that's coming.
Okay.
Yeah.
So there's more than one person, one
yeah,
bidding on it?
correct.
Okay.
So he will be meeting with me next Tuesday.
Sure was the swing voter. She's very powerful. What's your, that you could talk about the chairmanship and everything else. It still comes down to you need 3 votes to win stuff. Do you think Vera enjoys that, or do you think it's just she accepts that's the job and she's taking it on herself to go ahead and be that person?
I think she from what I gather from watching the meetings, I haven't been to a meeting in person in a long time, but from watching them and listening to it, I think she accepts that role. Obviously, I can't speak for her, but I don't know how much I would enjoy being that person. I think it's a hard job. And I think you're in a hard place, especially when you have to sit between those two groups of men every meeting and be that person in the middle, which I think she might be in the middle all of the way. I think she might sit between them too.
Yeah, a lot of fur flies around, Vera, and
So he will be meeting with me next Tuesday.
For clarification, for my own clarification, does the board have the ability, are we authorizing new providers to be hired and new lines of business to be added, or is that purely a CEO's decision?
I don't know of any houses on it at all.
Generally, has the CEO position.
Yes, but I would not hire another provider unless I had the board input and did a pro forma and had his salary, and as I will talk about in the executive session, about what we needed to do with salaries and wages with providers. But I think the board as a whole needs to approve if we are going to add providers as we move forward.
Hence the need for homework.
And the, like we keep saying, the financials.
Correct.
Right. And Mr. Hadley would not start until August the 1st.
But if we needed him sooner, he could.
We'll find out come Tuesday.
Can you find his car?
Yes.
He did get his car back.
Anything more?
Yes, I will state that doing some investigation work, unbelievable out of me, I guess, but we go back to the PACO system, where everything is stored on who's the signers and stuff with the Medicare and stuff. So looking at that system, there's going to have to be a lot of work done in there, and it's not going to take that long. But currently, the only board member in the PACO system is Connie. Every board member should be listed in the PACO system. So all that has to be updated. The only people that is on there right now is Maureen and Piper, but Piper only has limited access to some of that stuff. There's 48 physicians, providers listed in the PACO system. So we have a lot of providers someplace. So that has to be updated. So I'm sure it's going to take us a couple of weeks to get that lined out, but that's part of what, why we're here. The other thing is the oxygen upgrade. We did get that information, Piper and myself, to Mr. Gassing. And it looks like we can get all that done for right at $326,204, which is only $3,504 above what we received for the grant money.
How much did you say? 3,000 what?
$3,504. So I think it's in our best interest. We owe it to our community and our patients to be able to install a bulk oxygen system, which we should have had a long time ago. We have the grant money. It's only going to cost us, we can take it out of operations of $3,504. It's a positive move forward from a capital standpoint. We'll have a bulk oxygen system. We'll have a new manifold system. And we'll have a new zone bound system on the inside from a life safety point. That is great, and all new piping. So we just need a vote to go ahead and move forward with that. We have the grant money. The only expenses is $3,504, and it may not be that much. We just put in a little bit extra money there just to cover it. So it's either going to be only $3,504 or it's going to come in at $326,204.
Okay. May I have a motion for the,
Do you move it?
Although,
I know, but I like to
It
keep the
could.
board informed of what I'm spending.
Okay.
I don't feel we need to vote on the extra 3,000 some dollars.
You guys
I'm
think-
fine with that.
We have to vote on spending 300,000 for a.
It's already been voted on because it got a grant.
It was the grant.
And just as long as it's noted in the minutes, I mean,
Yeah.
I want to make sure the board is aware. It's not that they have to vote on it, but I just want to make sure it's aware.
Perfect.
And, did you have a
I was
question?
just getting ready to move it, but if we aren't doing it, then I won't worry about it.
Oh, thank you. Okay. Anything else?
Oh, the other thing is, the bank did call on the signature card, so, on the new signature cards, there's quite a few on there. Dottie's on there, Cam is on there, Piper's on there, Leanne's on there, and Sandy is on there, and I'm on there. I've never seen so many people on a signature card. Usually, as we move forward, we have the bank, the board president, the treasurer, then you have the CEO, and somebody in fiscal services. So, we don't have a CFO, so that, it could be Piper and Sandy. And I think that's all we need. We don't need anybody else. The more you have, the worse.
True.
Well, I'm not gonna say it.
The greater chance.
Yes, the bigger chance. And we don't want to get there.
No.
So I just need to make a motion that on the signature cards, that we have the board president, the treasurer. We have myself, Sandy, and Piper.
well, that's all, yeah, right?
And that's
I'm
it.
on there. You can gladly take me off.
I just want to get down to a number that's manageable.
We don't have any policy on that either, do we, that we need to change? I can't
There
figure
should be a
out.
policy on it, but I have not seen one.
Last
And I
year
think,
and
I
the year
don't think,
before.
I think Kim's on only one account. We can pull that bank list with who's
Yeah.
on what account, because I don't think Kim's on all the accounts. There's one account. for
Yeah,
Kim.
this was the only one she was on.
Okay.
Well, if you need to take me off, push yourself. Because then, like, the
How about I
banner-
leave you on
like
there
the
and I
banner
take my
activity
stuff
account,
off?
like, Casey Bergstrom's on, and the resident trust account, Lisa's, I mean, it's got different people on, depending on what the account is.
I just want to make sure we stay in compliance with everything as we move forward.
Well, I would think then if we have a policy somewhere that we can just change and update, and then once it's done, we'll just bring it on board, unless the
Right.
board wants somebody else on there that we're not included. Otherwise, I think a policy of change would be fine. Awesome, thanks.
Is that a motion?
No.
No,
No, it would
Go for the
be a
policy
policy
revision.
there should.
update, because, if it's not clearly stated, then we'll just not state it. Okay. Are you complete?
I'm more out.
You're wore out, okay. Well, with other reports, governance committee didn't meet this week because of weather and the town hall meeting. So.
Can I interrupt just a little bit?
Sure.
Back on that, back on changing the policy for the check for who's on the bank accounts.
Uh-huh.
It would be nice if when you get that policy changed, we as a board can vote on it.
Well,
Yeah.
absolutely.
Yeah.
That's the purpose. It's we can vote on it and then go look for it and then we change it and then
Right.
we bring it back. So we'll just bring it back.
Yeah, that's my point. Just let's bring it back.
That's fine. Ann. So then, foundation board, anything kind?
We have a meeting, oh, he's waiting.
Oh, jeez.
I'm
We
sorry.
just didn't know what the HH Leadership Solutions was.
Well, that's on education, and Stephen was going to speak on that later, maybe?
We don't have a leader.
No, we don't.
I'm available whenever you all would like to speak.
Stephen's there.
Yeah, Stephen, if you can speak a little bit about education for staff and, board and positions, as we talked about when we were meeting last week or week before last, about what your organization does you know, from an education standpoint, what you can kind of do for us from a, you know, not only from the janitors on up to the board of directors, but our providers, and kind of what the return on investment is and that type of thing.
No problem. Well, good evening, everybody. I appreciate you giving me the opportunity to speak and talk to you all. My name is Lieutenant Commander Stephen Hartz. I'm a retired naval helicopter pilot. I spent about 21 years on active duty service. I spent the last 7 years working in healthcare, focused on leadership development, board education, and advisory services. Our organization, H&H Leadership, really specializes in helping organizations improve performance through education and development. We work everything from board education, understanding governance, responsibilities, and duties, down to the board retreats, how to work on your strategic plans and implement them for your organization to be best for your staff. We work with staff members to improve communication, operational efficiency. My team is made up of former hospital CEOs, nurses, other professionals within the healthcare to really be able to dive in and find out what are your pain points within your department. Additionally, we do a lot with culture. You know, a lot of organizations we go into, there may be morale or cultural issues that our organization might be struggling with. So we try to bring everybody to the table and make it an inclusive experience to help individuals be the best they can. In my 21 years in the Navy, I've had the opportunity to lead people from 18 up to the flag ranks and really specialize in building that cultural development for an organization. We work in mostly critical access and humidity hospital systems nationwide. And typically when organizations work with us, we can do anything from performance improvement, optimization, financial resiliency, and our return on investment typically is between 3 to 6 times what an organization spends with us. So one of our greatest successes is an Eastern Montana hospital that was running at a minus 14% margin. In a matter of 2 years, we brought them to positive 2%. Helping them work on efficiencies and just kind of diving into all aspects of the organization and getting everybody educated and brought up to speed. That's the 30-second elevator speech. Does anybody have any questions? I'd be happy to answer anything you have.
Do you have any brochures or something we can look at?
I have some information that you just sent me.
Absolutely. When we were out there, we were actually visiting another hospital down in Wyoming. And took the opportunity to come up and visit you all. Okay. I do work down in Jackson Hole with their recruitment and leadership development.
Rich.
Yeah, it's a different hospital. Their biggest challenge is housing. But we took the opportunity to come up and meet your facility and a chance to talk with Randy. And so I left with him an idea of the scope of work and some thoughts on how we might be able to help your organization take it to the next level and get where the board would like to be.
Would you be available to come and speak to the board, you know, in more detail? If
Yes,
needed?
ma'am. I do have a formal presentation that I would be happy to come present to the board with all the services that we offer and anything that we can do. We have tailored programs. We can do it a la carte, however you all see, but I'd be happy to come out at any time.
Thank you, Stephen. Any
Yes.
further questions for Stephen? Thank you for joining.
Thanks, Stephen.
Okay.
No problem.
Connie, do you want to talk about foundation?
Sure. Basically, I would say that the foundation is looking at fundraising opportunities, and March 23rd with our daddy-daughter red carpet ball will be the first. It will be held at the senior center. I thought it was from 6.
Yeah.
Okay, this says 7. So
I was told 7. So
okay,
I will
yeah, that's
6.
why I looked at these guys because they were there.
6 to 9.
6 to 9. We do have limited capacity there, so the tickets need to be recommended that they're purchased ahead of time because we feel like they may get sold out. We have a limousine service that is part of the ticket, as well as the dance, decorations, refreshments. Another opportunity would be VIP parking. If somebody wanted to pay the extra fee to park up close to the door, there is that.
Silent auction.
Thank you. Silent auction. We'll be looking at asking for help, or if anyone wants to contribute to that, that will be available. So that's pretty much what we've kind of been working on. And these ladies here at the end of the table and myself are on the decorating committee. And
yeah, we really want to give credit to Charlotte and Kim. I mean, they have done an outstanding job on getting things together, getting things. I mean, it's beautiful, and what they have been, their presentations have been outstanding. And it's going to be a glorious night. I just know it. I talked to the limo driver last week. I sent pictures to Charlotte and to Kim, so I know it's going to be outstanding.
So we did tell people in the town hall that there is the availability of makeup, hair.
There is makeup, hair.
Dresses if you can't afford it.
Yes, there is dresses. A lot of my daughter's dresses are over at the house. I did email. I told my youngest daughter that she has 3 more dresses that I just bought to send them to me ASAP because I need them for additional women.
And there's no age limit, right, Con?
no.
Yeah.
If a 90-year-old
Oh,
dad
you'd be
wants to bring a
90-year-old?
70-year-old daughter, awesome. We'll take it. No. And the other component is we want to make sure this opportunity is available to anyone who really would like to come and they don't feel that they can afford the tickets, community people. And
We will pay for their admission. If they cannot afford, no one will be turned away because of the cost.
How much are the tickets again?
25.
25?
Yeah.
And then additional child is 10.
That sounds about right.
So the 25 is for a father and 1 daughter.
Okay.
And then an additional
Right.
$10 for
Okay.
extra daughters.
And Walter, we do want to make sure we thank everybody right now for all those donations that we have received so far, and we thank you in the future for the donations.
I'll make sure to cut that out of the video.
That's my
Yeah.
boy.
There's been some great community support, and people are excited to help with it. This is for the scholarship fund. Some of the other fundraisers that we plan might be for other purposes, for equipment and so forth, but that's our primary purpose this time.
Any questions for Connie? No? Okay.
Good, because I don't have a memory.
You don't mind if I show up and take pictures of that event, do you? Because that's going to be awesome.
Thank you for mentioning pictures.
You
We
could be
will
the
have a
paparazzi.
photographer, and we're
I'll be the
hoping-
paparazzi.
Yes.
I don't have that many flashes.
Our plan is to have a red carpet and they walk down and, you know.
That'd be so
I would be honored to cover that. That would be really kind of neat. I got an idea I want to talk to you about.
Absolutely.
All right.
Okay, so items for the future, just a reminder that from February 7th to the 26th is the district tentative filing. March 23rd is the dinner, as Connie mentioned. May 7th is the special elections, the district elections. And May 18th is the WHA CEO spring meeting.
Is that board and CEO? Or just CEO?
CEO.
Yeah.
I thought it was board and CEO.
Well,
Oh, we'll take it. Your board's welcome to go.
What is in the fall? I thought it was in the spring.
There's one in the spring, one in the fall, something like that. Anyway, are there any?
Usually the board is in the spring, it seems like the past couple of years, because it's been in May right when we were writing
Right.
the board.
Oh, the board training.
Are there any other comments or issues? Yes, Carrie?
I searched all day today, well, not consecutively, but I looked for the
agenda online and old minutes online, and they weren't there.
Yes,
So-
it needs updating.
Okay,
And I need to get a spot for the agenda on the one.
thank you. Thank you.
Anyone else?
I wanted to say thank you for your guys' decision on the masking. I just really appreciate you guys doing that.
Well, you know, we appreciate that fact that you came here and you presented yourself so wonderfully.
Oh, thank you.
And it was our pleasure to work with the staff to come to that conclusion. We had a lot of help from lots of people on staff, and really, Devin and Piper completed the changes in the policy, and it was our pleasure.
Okay, well, thank you. I just wanted to tell everyone thank you. I really appreciate that.
Well, thank you very much. Anybody else? If not, we'll move into executive session now. Thank you for coming. Can we have a motion to, thank you, Connie.
I'll
Can I have a
second.
second?
I'll second.
Thank you.
Seconds.
Aye.
Thank you. Opposed?
What is it under?
Personnel.
Personnel? Aye. Thank you.
No. Personnel.
Yeah.
This was the minute.
Come on, turn off.